Remote Patient Monitoring, RPM, Global Startup Deep Dive Analysis Q1 2025 Report Executive Summary. Remote Patient Monitoring, RPM, has emerged as a foundational component of 21st century healthcare infrastructure, facilitating continuous, personalized, and decentralized care delivery. No longer considered a niche or adjunct solution, RPM is now critical across a range of care domains, including chronic disease management, post-acute care, maternal and neonatal monitoring, oncology, and cardiology. This paradigm shift has been accelerated by global transitions toward value-based care, increased payer reimbursement, for example, CMS CPT codes in the US, DGA in Germany, NHS frameworks in the UK, and the growing adoption of hospital at-home models. In this Q1 2025 analysis report, we present a comprehensive global scan of 65 RPM startups offering 73 distinct products across 8 countries. These solutions were evaluated through our proprietary AI agent-powered digital health evaluation solution, which assessed each product's clinical rigor, technical maturity, regulatory compliance, and payer alignment. Based on a tridimensional scoring framework, we classified solutions into 3 tiers: top tier, 9.0 to 10.0, second tier, 8.0 to 8.99, and third tier, 7.0 to 7.99. The findings reveal a dynamic and competitive landscape where a handful of clinically validated and commercially scalable solutions are setting new standards for RPM-enabled care. These solutions are leveraging FDA and CE-cleared sensors, AI-based analytics, cloud-based EHR integrations, and specialty-specific care pathways to enable proactive, efficient, and outcome-driven healthcare delivery. 1. Methodology and evaluation framework. To ensure a rigorous and objective assessment of RPM solutions, we employed a tridimensional scoring model that integrates 3 critical domains: real-world usability, scientific validity, and regulatory market readiness. The evaluation was powered by our AI agent-powered digital health evaluation platform, which enables consistent, repeatable, and evidence-driven scoring across heterogeneous solutions and geographies. The first evaluation domain, general capability and usability, assessed how well each RPM solution fits into the daily lives of patients, caregivers, and clinicians. Sub-factors included ease of device setup, interface intuitiveness, lifestyle adaptability, accessibility across demographics, for example, language, age, disabilities, affordability, and caregiver support mechanisms. We also examined integration with EHRs, patient engagement features, and care team dashboards. This dimension emphasized the real-world deployability and scalability of each solution, recognizing that even clinically advanced solutions are ineffective without intuitive and seamless user experiences. The second dimension, scientific validation, examined the clinical and technological soundness of each solution. Evaluation criteria included the presence of FDA 510(k) or de novo approvals, CE or UK certifications, and evidence from randomized controlled trials, real-world studies, or observational cohorts. Solutions that demonstrated statistically significant improvements in clinical outcomes, such as reductions in hospital readmission, improved medication adherence, or better chronic disease markers, received higher scores. We also considered the presence of peer-reviewed publications, adherence to specialty-specific protocols, and the integration of AI or machine learning for early detection or risk stratification. The third dimension, medical compliance and reimbursement, evaluated each product's readiness for deployment within regulated healthcare ecosystems. We examined compliance with data privacy and security frameworks including HIPAA, GDPR, ISO 27001, SOC 2, and MDR, as well as infrastructure for consent management, data encryption, and auditability. Equally important was the solution's eligibility for and use of CPT billing codes in the United States, 99,453, 99,454, 99,457, 98,975, 98,977, as well as its alignment with other international reimbursement pathways such as DGA, Germany, and NHS Innovation Accelerator, UK. Solutions that had established relationships with public or private payers, participated in government-funded pilots, or were used in accountable care organizations, ACOs, received higher marks. Each product received a score from 0 to 10 in each of the 3 domains. The final composite score was calculated as the average of the 3 individual scores. This composite score informed the tier placement, as follows: top tier, 9.0 to 10.0, solutions demonstrating excellence across all 3 domains, representing market leaders with high scalability, strong regulatory standing, and clinical validation. Second tier, 8.0 to 8.99, solutions with strong domain performance but requiring further validation, payer integration, or global expansion to reach top-tier readiness. Third tier, 7.0 to 7.99, emerging or niche solutions with innovative value propositions but lacking comprehensive validation, regulatory breadth, or reimbursement alignment. 2. Top-tier analysis. Top-tier RPM solutions exemplify the convergence of clinical excellence, technological sophistication, and operational scalability. These companies have successfully demonstrated not only regulatory compliance and outcome-based effectiveness, but also an ability to integrate into the daily workflows of providers and the lifestyles of patients. Element Science leads the top tier with a composite score of 9.67, representing a gold standard in cardiac RPM. Its wearable cardioverter defibrillator delivers real-time arrhythmia detection powered by advanced AI algorithms, coupled with the ability to perform life-saving interventions when needed. The solution has secured CE and UK approvals and is undergoing pivotal clinical trials in the United States. It exemplifies a new generation of RPM tools that are therapeutically capable, not just observational. Close behind are solutions such as Huma, IDOVEN, and Implicity, each of which supports multi-country RPM deployment with deep specialization in cardiology, AI-powered diagnostics, and remote clinical trial enablement. These solutions operate in more than 70 countries and have developed scalable infrastructure capable of supporting pharmaceutical, provider, and payer partnerships. Several US-based solutions also fall within the top tier. BioIntelliSense offers FDA-cleared biosensors like the BioSticker and BioButton, which are widely deployed in hospital at-home programs. Huma focuses on post-acute recovery and veteran care, providing a robust combination of wearable data streams, AI analytics, and direct care team integration. VitalConnect and PhysIQ offer similar capabilities with strong alignment to CMS reimbursement workflows and advanced signal processing algorithms. Athelos provides home-based oncology monitoring through its Athelos One and Athelos Home solutions, enabling critical white blood cell and neutrophil monitoring for patients undergoing chemotherapy. Spire Health delivers passive respiratory monitoring through its HealthTag device, tailored for chronic lung diseases like COPD and asthma. Innovative form factors are also represented in the top tier. Kasana's Heart Seat, a smart toilet seat that tracks cardiovascular health passively, is designed for aging-in-place environments, while Community Wellness delivers maternal and chronic care services through a wraparound virtual clinic model. Natera offers contactless, radar-based RPM, OxHealth applies vision-based AI to detect physiological changes, Ensure specializes in oncology monitoring, Zephyr offers cloud-based spirometry for pulmonary health, and CloudDX, a key player in Canada's virtual ward infrastructure, supports both acute and chronic care use cases. Collectively, these solutions are not simply product vendors, they are foundational enablers of data-driven, decentralized, and preventive healthcare. 3. Second-tier analysis. Second-tier RPM startups are highly credible and technologically sound solutions that are gaining traction in specialty markets or regional health systems. While not yet at the same scale or level of validation as top-tier players, these companies have demonstrated strong product-market fit and clear pathways to higher-tier classification. AcuHealth, Coach Care, Optimize Health, and health recovery solutions support chronic disease management using cellular-enabled devices, real-time care team dashboards, and workflows aligned with Medicare's RPM and chronic care management (CCM) billing codes. These solutions are focused on patient adherence, clinician efficiency, and scalable integration with provider networks. AI-enabled solutions such as Maya MD and MD Revolution are expanding into behavioral health and chronic care by combining virtual triage tools with personalized care planning and risk scoring. Remedy, Clear Arch Health, and VitalTech operate in enterprise environments, providing white-labeled solutions for hospitals and large provider groups with Epic or Cerner integration. Include Health and Limba Health are actively innovating in the musculoskeletal, MSK, and rehabilitation space, providing RTM, remote therapeutic monitoring, solutions designed to support recovery and therapy adherence. Marani Health offers a maternal health RPM solution that includes fetal and maternal vitals tracking, while Analytics focuses on neurological disorders such as Parkinson's and multiple sclerosis, with added capabilities for fall detection. From Europe, notable contributors include BioSerenity, with its sleep and cardiac monitoring offerings Cardiophy and Somnophy, Medvir, Carematics, and Sweden-based Care Lego, which supports elderly heart failure patients. Validic stands out for its robust device integration engine, powering over 500 connected devices and enabling population-level data aggregation. While these solutions are clinically credible and technically mature, most require further validation in the form of peer-reviewed evidence, broader international regulatory coverage, or payer expansion to reach top-tier status. 4. Third-tier analysis. Third-tier RPM solutions represent early-stage companies or niche solutions that show promising technological differentiation, but have not yet achieved widespread adoption or clinical validation. These solutions may focus on underserved populations, novel use cases, or unconventional form factors. However, limitations in EHR integration, regulatory certification, or reimbursement eligibility currently hinder their scalability. Vena Vitals introduces a wearable that continuously monitors blood pressure, a novel capability with strong market interest, though it remains in early validation phases. Medec RPM and Life Plus, particularly through its Donia Care initiative, focus on elder care, frailty detection, and chronic disease management, but their expansion is constrained by regulatory readiness and payer penetration. Many of these solutions cater to specific demographics or clinical environments, such as post-ICU monitoring, pediatric RPM, or home dialysis care. Although their innovation potential is significant, they must overcome barriers in terms of clinical data generation, cybersecurity compliance, and workflow interoperability. Participation in accelerators, co-development partnerships with medical device manufacturers, and enrollment in government-funded pilot programs could accelerate their path to higher-tier classification. 5. Strategic trends and insights. Several macro trends are reshaping the RPM sector in 2025. The convergence of hardware and software is leading to solutions that combine smart sensors, wearable devices, mobile applications, and AI dashboards into seamless care delivery ecosystems. Real-time predictive analytics is enabling earlier interventions and personalized care plans, especially for patients with multimorbidity or complex conditions. RPM is also expanding into new clinical specialties, moving beyond cardiology and diabetes into areas like maternal care, MSK rehabilitation, oncology, neurology, and behavioral health. The rise of passive monitoring technologies, such as radar-based sensors, smart toilet seats, and vision-based AI, points to a future where frictionless adherence becomes the standard. Simultaneously, hospital at-home programs and virtual wards are gaining traction, driven by CMS, NHS, and private insurer support. These models are creating demand for RPM solutions that can operate reliably across acute, subacute, and long-term care pathways. Regulatory maturity and interoperability are now baseline expectations for top-performing solutions, with compliance to FDA, CE, HIPAA, GDPR, ISO, and SOC 2 increasingly necessary for market access and trust. 6. Strategic recommendations. Top-tier companies should prioritize global expansion, deepen payer relationships, and consider vertical integration with pharmaceutical manufacturers, hospital systems, or care coordination networks. These companies are well positioned to lead efforts to standardize RPM protocols and drive adoption across new geographies through strategic partnerships and localization. Second-tier startups can ascend into the top tier by generating more rigorous clinical outcomes data, expanding device interoperability, and enhancing their value proposition to payers through CPT code optimization for RPM, RTM, and BHI workflows. Targeted partnerships with academic institutions or government-funded trials can also facilitate validation and reimbursement alignment. Third-tier innovators may benefit most from accelerators, co-development deals, or targeting specialized niches that are underserved by mainstream solutions. Focus areas such as pediatric care, frailty prevention, or post-discharge surveillance could provide market entry points, particularly if supported by public health funding or value-based care initiatives. 7. Conclusion. Remote patient monitoring has become a central pillar of digitally enabled, value-based care models around the world. The solutions analyzed in this Q1 2025 deep dive reflect the maturity, innovation, and diversity of this market. From predictive cardiac monitoring and oncology RPM to maternal health and passive geriatric monitoring, RPM solutions are reshaping healthcare delivery at scale. The most successful solutions combine scientific rigor, intuitive design, and regulatory readiness, creating care models that are not only clinically effective but also financially sustainable and operationally scalable. As the next 12 to 18 months unfold, we expect to see continued convergence across RPM, remote therapeutic monitoring, RTM, chronic care management, CCM, and AI-driven clinical navigation. The startups leading this transformation are not just building products, they are architecting the future of hybrid, personalized, and data-powered healthcare.